way of introduction, because I know that there might be a lot of girls on this call. If you've never heard of a gynecologist, I'm a special type of doctor just for girls. So this is the perfect topic for me. So specifically, so unlike most gynecologists who see like adult women, I specialize in seeing girls from age 0 or from like when you're born, up to age 18, 19, 20, sometimes even up to 24 or so. And so this talk, so these are two of my favorite books on puberty. The first one is called Celebrate Your Body, and the other is a classic. It's definitely different than when I read it. It's called The Care and Keeping of You, by the American Girl doll series. So just as a disclaimer, I have used a few pictures from these books and stolen a few phrases, so it might look a little familiar to you throughout this talk. Okay, so first of all, what even is puberty? So puberty is basically going from a little kid body to an adult body, and it's can be a little complicated, but it's a universal experience. It happens to everyone. And it's okay to have pretty complicated feelings about puberty. I know there's a lot of girls out there who may be really excited about the possibility of breast development or even periods. Or there are some people who could feel the exact opposite. And just for the record, I was one of those girls. The last thing I wanted to do was go through puberty. And so this is something that I've thought a lot about. And I just want you to know that whatever you're feeling, the good, the bad, both of them, it's okay. It's normal. And it's really helpful to talk to somebody about how you're feeling. So I'd recommend talking to, your parent, another trusted adult, or you can even come to see me. And I'm more than happy to answer any questions or concerns or just talk about what changes might be happening to your body either right now or in a couple of years. So let's talk about what to expect with puberty. So I'm going to be using this word hormones a lot. So let's talk about that. So when I think about how, like, if you think about how your brain communicates to different parts of your body, like if you think about how your brain tells your hand or to move around, your body has two ways of doing that. The first one is through nerves, or basically electricity. Um, and it's literally telling your hand to do something. So I imagine it like a telephone, like one of those old telephones you have to plug into the wall. And there's like electricity going through those wires where your brain can tell a certain part of your body to do something that it wants you to do. But a different way that your brain can use to communicate to a distant part of your body, so like your stomach or your toes or your bladder, is by using hormones, which I like to visualize as like a text message. So it's not electricity, it's little chemicals that your brain can send out and talk to a different organ. And so the changes that are happening to your body during puberty are driven by these hormones or your body's chemical text messages. And so there's a whole bunch of them out there, but the most important ones for you, or the ones that we're going to talk about today, are called estrogen and testosterone. Oh, sorry, not testosterone. Testosterone is actually really important for puberty, but it's like estrogen, progesterone, and testosterone. All right, next thing. So the hormones are going to get going probably before you even see any changes to your body. But the first thing that you actually might be able to notice is that things start to grow. So the first thing that happens to most girls is that you start getting taller. You go through a growth spurt. And it's really important because your body is getting taller. You do actually grow in your sleep. So this is a really important time of your life to make sure that you're getting enough sleep and also make sure that you're fueling your body the way that it needs to. So make sure you're getting lots of exercise and good, healthy food. And unfortunately, no one really has control over how tall they get. A lot of the instruction manual for your body depends on your genes. So let's talk about genes really fast. So all humans are born with their own set of genes, which are basically the instruction manual that your brain and your body follow to turn your body right now, how it looks right now, into an adult body. And so genes dictate if you're going to be someone who's tall or short, like me. I'm very short. Your genes dictate if you are going to be someone who might be a little bit heavier or a little bit lighter. It even tells you like what your eye color is going to be or your hair color. And so we can usually kind of get a sense of what your adult body is going to look like by looking at your family's genes, like your mom, your dad, your aunts and uncles, your brothers and sisters. But sometimes it's actually, sometimes you look completely different, and that's okay. Everyone's bodies are one of a kind. And one of the hardest things about puberty is learning to love the body that you have. Okay, so not only are you growing taller, but you might notice that a different part of your body is growing, and these are your breasts. So let's talk about that really quickly. So, breast buds, or the beginning of breast development, is usually for two-thirds of people, or 66%, usually the first sign of puberty for a lot of girls. And you don't always see like an actual growth in size, but sometimes the first sign is that they feel a little sore. Like if you touch it, or you run into something, that might hurt a little bit, and that's normal. Next, you might feel that there's a little hard bump under your nipple, and that's what we call the breast bud. And so, just by way of like vocabulary, so the nipple is the raised part of your breast. And then there's this darker circle of skin around it. We call that the areola. And I'm going to talk a little bit more about like what the difference between those two are. But sometimes, in addition to seeing a little bit of growth in your breast, the nipples might also get a little bit bigger, or your areola, or the skin around the nipple, tends to look bigger or puffier as well. Okay, another thing that you might start noticing is that you start getting hair in different places than you had before. So one of the most uh, notable areas where you might start growing hair is what we call pubic hair, which for about a third of people, so maybe like, maybe 1 in 10, or, 1 in 3 people, somewhere like that, this is actually the first sign of puberty. And that's okay. That's just, it's a variant of normal. So when we say pubic hair, so the pubic area, that's like your private area, or some people call it their vagina. And so this is just when you get hair over that area, and it starts to look like an upside down triangle. The hair that you grow in your pubic area typically matches the hair on other parts of your body. So if you have dark hair, the hair is probably dark. If you have really straight hair, it might be kind of straight. But sometimes it doesn't always match the hair that's on your head, and that's okay. Everyone's different. And so we'll talk a little bit more about this later. All right, finally, kind of the thing that a lot of people think about when they talk about puberty is periods. Let it flow. There's, going to be a variety of different fluids that your body is making, and we're going to talk about all of those today. So here's just a different way of looking at the timeline. So a lot of folks start, so everyone's different in terms of when puberty starts. For some girls, it starts as early as 7 or 8, and for others, it doesn't really start until 10, 11, or even 12. And that's okay. Once again, that's usually a gene thing. It's all about what the instruction manual in your body is telling you to do. And it's okay. And if you have any concerns about, hey, is this too early or too late, you just come talk to me, and I'll let you know if this is something that we should investigate further. So around age 7 to 11 is when your body starts making those hormones, or those chemical text messages, which signal to the rest of your body that puberty is ready to start. About a year or so after that is when you develop breast buds, or the first sign of breast development. And you also tend to get your growth spurt at around the same time. For most people, pubic hair comes second, so after the breast budding. But once again, sometimes it comes first, and that's okay. And around this time, you might also notice that you're getting hair in your armpits, and that the hair on your legs is getting a little longer and a little darker. Um, Girls can start periods as early as age 9, but we typically don't want someone to go longer than age 15 before their first period. And kind of a rule of thumb, if you're wondering when you're going to get your first period, it typically happens about 2, sometimes 3 years after you start wearing bras, or you see the first sign of breast development. So you can kind of calculate like when it can happen based off of that. And around 15 to 16 is when puberty is in full swing. And I would actually disagree with this chart just a little bit, because I actually think that there are some puberty changes that don't stop at age 16 or 17. There's changes that are still happening into your early 20s. So this is a really, really long process. Okay, so let's focus on what starts growing at the beginning of puberty? So, first of all, once again, the goal of puberty is to go from a little girl body to an adult body. And so there will be size and weight changes. So you're not only going to start growing more muscle, but you're also going to grow fat, and that's okay. That's a good thing. For me, one of the ways when I was younger, the first good thing that I liked about puberty, because I was a soccer and a basketball player growing up, so I played a lot of sports. And when I went through puberty, I got really, really fast and I got a lot stronger as well. And I felt like I could run for longer distances, and that just I kept increasing until my early 20s. And I was like, wow, this is amazing. I mean, I wasn't a huge fan of the period thing or the breast thing, but the faster and stronger was pretty cool for me. You might notice that you start to just overall look a little softer and rounder, especially around the hips or thighs. You might notice that you have a little bit more fat around your upper arms and back. And your waist, which is the part of your body just under your rib cage, might also become a little more narrow, and your breasts start to get bigger. And there's lots and lots of different body sizes and shapes out there, lots of variations of what we consider normal. And once again, it's your genes or the instruction manual that you inherited from your mom and dad that really dictate what your adult body is going to look like. So I know I just mentioned the word fat, and I think a lot of it's hard to be a girl in this country because we're programmed to think that fat is bad. Fat in the diet is bad. You don't want to get fat. But I really want you to know that fat is actually so, so important for puberty. If you don't have enough fat in your body, puberty doesn't work. In fact, I see a lot of girls in my office who, we talk about puberty problems because they're so because they're trying really hard not to become fat. And fat is a really, really important organ in your body. It's important for your brain. It's important for your hair and your eyes. It's a really important energy source. And if you don't have enough fat in your body, then puberty kind of stalls out. Um, and so I really want to emphasize the point of as your body is growing in size and shape, it's normal to gain weight. In fact, we want you to gain weight even into your early 20s. Once you become an adult and you're like mid 20s and 30s, then we start talking about, okay, let's maintain weight, but you are supposed to gain weight and change your shape. And this is a conversation I have to have with a lot of girls. And so this is something that's really important. Okay, enough about the fat stuff. Let's talk about hair. So there are so many different varieties of hair out there, and how you care for your hair during puberty and after puberty really kind of depends on your hair type. So one of the things about puberty is that your body naturally starts producing more oils. And for some people, depending on their hair type, you can see the increased oil production on your hair. So if you're someone like me who has kind of fine hair, my hair gets oily really quickly. And so you might be someone who needs to wash your hair more often, like every day or every other day. But if your hair is more dry or you're more prone to dandruff after washing your hair, like getting a dry scalp, you might be someone who needs to wash your hair once a week. But you might find that you have to wash your hair a little bit more often than you used to when you were younger. So, as we talked about, another hair topic during puberty is getting pubic hair. You can also get hair in your armpits, and you might notice that the hair in your arms or legs starts to get darker. It's also normal. So that those kind of things happen to pretty much everyone. But depending on your genes, it's actually normal to get a few hairs, not a lot of hairs, but a few hairs on your breasts, your upper lip, or even your back and your chin. And that's okay. It really just kind of depends on your family. If you feel like it's too much hair, that's when you get to come talk to me. So let's talk about shaving. So shaving is a personal choice. You do not have to shave, but a lot of people do. Having hair on certain parts of your body is a normal part of puberty. So if you want to learn how to shave, I would strongly recommend asking an older, like a trusted adult or an older sister or friend to help teach you. But I just want to emphasize, be very gentle when you start. You do not have to push hard. I also want to emphasize how to take care of your razor if you decide to shave, it's really, really important to make sure your razor is sharp and new, and that you change it often. If you try to use a dull razor that's not very sharp, that's when you start to get these really, really painful bumps and rashes where you shave. I know that it's really convenient to leave your razor in the shower, but that's actually the worst place to store your razor because there's so much water and humidity that it's prone to rust. And using a dull razor like that can cause some real problems with your skin. Shaving also tends to be most comfortable when you use shaving cream or soap. It's also really important to moisturize your skin after. So, you use lotion on your legs. Um, but be careful. If you some of the parts of your body that you shave can have are really can have like really sensitive skin. And some of these soaps and shaving creams can cause some skin irritation. So you just need to be careful with that. I also want to emphasize that you should never share razors. Razors are a way, just because you can sometimes cause small cuts in your skin. And so you don't want to use someone else's razors because you could technically transmit dangerous diseases to somebody else, or you could get one from somebody. And so make sure that you're always using your own razor. Okay, how to care for pubic hair. I get this question a lot in my clinic. So first of all, I know that culturally some people have, everyone's got a different relationship with their pubic hair. But from a doctor's perspective, pubic hair actually has a really important role in your body. The skin of your vulva, or like the outside of your vagina, is really, really sensitive, and having hair there helps protect it from the world. And so removing that hair can lead to some like sensitive skin issues and rashes where you can have itching or pain, or something like that. However, even though pubic hair has a role, like other hair on your body, it should also be taken care of. So I get a lot of kids who are concerned about, does this part of my body smell? Like, how can I prevent it? And so the way that you take care of your pubic hair is by showering or bathing daily, just by washing. It's also really important to wear cotton underwear, which I know is like not the cool underwear, but like this is by far the best type of underwear for your vulva. It allows the skin to breathe. If you sweat, it dries quickly. And like really tight clothing, like leggings, or spandex, like they can all cause some like some serious itching and rashes on the vulva. It's also a part of your body that knows how to clean itself. So I recommend using at least water on that part of your body. You can use a gentle washcloth. Don't scrub aggressively. Some people even just use their hand to clean between all the different skin folds there. But soap is optional. If you're someone with really, really sensitive skin, you actually don't need to use soap. If you feel better using soap in that part of your body, I recommend using something that is designed for sensitive skin and has no scents in it. So one of the things that we like to tell is, the Dove soap is tends to be a really good option for folks. So let's say that don't want to remove your pubic hair, but you're worried about like, hey, what about swimsuits? So one thing you can do is you can just change the type of swimsuit that you wear. So you could wear like a swimsuit that is looks like shorts, than like a bikini bottom. You can also just take a sh pair of sharp scissors and trim the hair so it doesn't stick out from under the swimsuit line. You could shave with a razor. Um, I would actually recommend against shaving with a razor. Once again, you can get some small cuts on your skin that, because bacteria normally lives in this part of your body, that part of your body can actually get really can become infected. And I've seen some infections from people using razors. So I would actually recommend that if you're going to try to trim that hair, use either scissors or a special type of pubic hair clippers, like what's shown in this picture here. And I think that that's going to be a little bit safer. Some people also choose to wax, which sounds very painful, but it's another common way that people use to manage their hair. Okay, let's talk about the acne. This is unfortunately not a fun part of puberty, and this is hormones are absolutely to blame. I guess the one positive thing about acne is that you're in good company. Almost everybody deals with pimples during puberty and even later in life. So what happens is that hormones, once again, cause your body, not just along your scalp to affect your hair, but also along your face and other parts of your body. So this extra oil on your skin mixes with sweat and dirt and then clogs your pores. And the way that your body responds to that is by forming a pimple. So the best way to prevent acne from forming is by having a good skincare routine to help prevent breakouts. Most pimples form on like your forehead, your nose, and your chin, but they could happen anywhere. So, the most basic skincare routine should consist of washing your face every single day, usually at night, with a specific facial cleanser. So, don't use like body wash or a big, bar of body soap because your skin is also, or your face is also a place where you have some sensitive skin. So, you want to make sure that you're using a very gentle soap. And after you're done washing your face, you moisturize with a special face lotion. If you feel like you're still dealing with acne, you can go with one of your parents to a drugstore to get some anti-acne cream. Make sure to only use a very small amount, maybe once or twice a week just to get started because it can sometimes cause some sensitivity on your skin. And I know that it's so tempting, but try your hardest not to pick those pimples because you can take a little tiny pimple and turn it into a big flare up because of the dirt and bacteria on your hands can mix with the pimple and make a small problem a lot bigger. Another thing that happens during puberty is not only is your skin making more oils, but it's also, making more sweat. You're going to start sweating more under your arms and your armpits, on your feet, and even between your legs. And the sweat itself is not what causes body odor, but it's sweat and bacteria combined that cause the smell. So the way that we fix the smell is by good hygiene. Once again, wash your body every day because you sweat every day, you should really consider washing your body every single day. You don't always have to wash your hair every day, but at least your body is always a good practice. Another thing that a lot of people use is they put deodorant under their arms. And there's two types of deodorant. So there's the deodorant, which, as the name suggests, is deodorant, or it just kind of removes the smell. But there's another category, and you really have to look on your deodorant, called an antiperspirant. And this is designed to help your body stop sweating or to sweat less. But it's really important. If you decide to use an antiperspirant, that should only be put in your armpits, not on any other part of your body. You technically shouldn't be using deodorant down by your groin or your pubic area anyway. As a gynecologist, I think that that can cause some skin irritation. So really, deodorant should be just used along the armpit. Okay, next topic. Let's talk about breasts and bras. So we've divided breast development into 5 different stages, and we're going to go through each of these stages. For most girls, it takes about 3 to 5 years to go from stage one, which is pre-adolescent breasts, to stage five, which is a full-blown, adult type breasts. But for some people, it's even slower. It can take up to 10 years. And I really do think that most people are still having some degree of breast development, even into their early 20s. So stage one is the pre-adolescent breast. So, you'll probably stay in this stage for most of your life until age 7, 8, 9, 10 or so. So this is when breasts are completely flat with the chest. There's a nipple there. There's a small areola or that colored skin around the nipple. And hey, let's spend a second on nipples. So I don't know if you know it. So nipples, like their job, because so breasts are there to help with breastfeeding. Whenever you have a baby and you decide that you want to breastfeed that baby, breasts are designed to make milk and release milk, and the nipple is where the breast comes out. And if you think about how nipples work, so they have these tiny holes in them that you can't see. They're so small that release milk to feed babies. And so it's actually not one big hole, but if you think of like a shower head, that's kind of what the milk looks like when it comes out. The areola or the dark circle around the nipple, so the nipple's the raised part. The dark circle is, we think, we're not really sure why it's there, but we think it's kind of like this landing pad. Or if you think about an airport, how there's like, bright lights on the runway to help the airplane land, we think it's kind of like the landing pad for the baby to help the baby find the nipple. And everyone's areolas are different. Sometimes they're light, sometimes they're dark, sometimes they're small, sometimes they're big. And you're going to notice as in breast development that your areola will change. So that was stage one. Stage two is breast buds, or this is the very first sign of breast development. And so once again, usually it starts as a little bit of soreness, and then you might feel kind of this nickel-sized lump under your nipple. And this just means that the breast tissue and the milk glands are beginning to grow. The nipples and the areola may also get larger and darker. Stage three is when those breasts are even a little bigger. In fact, this is the time when they look a little pointy or cone shaped. They're not going to stay that way forever, but this is what is stage three. Stage four, though, is when that cone shape disappears and the breasts start to look pretty similar to what your breasts will look like in your adulthood. The areola and the nipple. So one of the reasons why in stage three it looks cone shaped is because the areola and the nipple tend to be a little more pointy than before. In stage four, they kind of start to recede back into the breast. In stage five is what we consider adult shaped breasts, where you're fully developed, they're rounder, and they're fuller. So breasts come in so many different varieties. They can be big, they can be small, they can be round, they can be pointy, they can sit high on the chest, or they can hang low on your body. The nipples, you know what? They can point up, they can point down, they can point in, they can point out. Some nipples stick out a lot, while others are inverted and they don't stick out. Sometimes the areola or the skin around the nipple is big, sometimes it's small, sometimes it's dark or it's light. Once again, it's all about the genes. It's all about the instruction manual that you were given and that your body likes to follow during puberty. Just as an aside, because I get a lot of patients come talk to me about this, it's actually really common for one breast to be larger than the others. We call this asymmetric breasts. In fact, it happens to about half of women. Like one in two women that you see has a breast that is bigger or smaller than the other one. We get a lot of kids concerned in puberty because sometimes the asymmetry or the difference in size tends to be a little bit more obvious in puberty because one breast just starts growing faster than the other. But a lot of the times, the other breast catches up, and the asymmetry either disappears or becomes less noticeable over time. And so I like to just encourage people to be patient. The way that your breasts look at age 13 is probably not what they're going to look like at age 20 or so. The breasts will likely even out over time. Also, so this is a picture of a breast. There you may notice, some people have this, that there's some small bumps around the nipple and on the areola. So these are not pimples. These have a name. They're called the periareolar glands of Montgomery. I have no idea who Montgomery is or like what kind of doctor he was or if this is a place. But these glands produce a fluid that help keep the nipple from becoming dry and cracked during breastfeeding. So they've got an important job. Don't think that please do not pick them thinking that they're acne. I've had a couple people come to me because they thought that they were acne and they picked it and it became a sore that became infected. So just leave these alone. They've got a job. All right, so let's talk about bras. So if you start noticing breast development, a lot of people choose to wear a bra. And there's, whether you choose to wear a bra and when you start to wear bras, this is a very personal question that's between you and you and your parents. But bras are kind of nice sometimes because they are designed to make movement a little easier. As your breasts get bigger, they sometimes bounce around when you're running or jumping, dancing, or like playing sports. And so bras are designed to just kind of keep things securely in place and just help you feel more comfortable. So even if you don't wear bras all the time, wearing them at least part of the time can be really helpful. It's also nice to have a little bit of cushion between your breasts and your shirt. Sometimes bras can help make your breasts look a certain way, which is like sometimes helpful, depending on the clothes that you wear. And there are so many different bras out there. When you first get started, you're probably going to wear something like a training bra, which is like just kind of like a tight shirt basically, without a lot of support. Um, and as your breasts get bigger and as you get older, you might start exploring different options. So sports bras are really stretchy, and they're designed to like hold your breasts securely in place. And then there's other bras that have, cups. There's so many. But because there are so many bras out there, don't settle for an uncomfortable bra. I mean, it's gonna take some time for you to get used to wearing a bra, but if it's digging into your skin or causing red marks, it might be time to switch brands or get a new one. It's also important to get measured, like, go to a store and actually get measured to make sure that you're wearing a bra that's the right size. Okay, so let's talk about some other changes in the private area. So we're going to talk about vaginal changes. So we're going to talk about some anatomy and some definition of words. So I kind of default into very medical terms, and I'm beginning to and I've realized over time that not everyone uses these words. So I think everyone's got different words for the private part of their body, and like that's okay. You should absolutely use the words that you feel comfortable with. The words that we use in medicine or with doctors are vagina and vulva. And these are different. I think a lot of people have heard of vagina, but not everyone has heard of the vulva. So the vagina is actually the inside part of your body. So this is a canal that connects the outside world to the uterus, which we're going to talk about. So it's right here, this inside part. The vulva is what we doctors use to refer to the outside of your body. And so there's lots of different parts to the vulva, which we're going to go over in just a second. But remember, vagina is on the inside, vulva is on the outside. So that's what those two words mean when I use them. So let's talk about all the different parts, the different anatomy. So, first of all, so remember, we were just talking about the vagina. So, everyone has three holes. The top hole right here. So, this is the urethra. This is where your pee comes out. The middle hole, this is the vagina. This is where period blood comes out and eventually where babies come out during pregnancy. And then right here at the bottom, this is the butthole, also known as the anus. This is where poop comes out. So, there are three separate holes. The top part here, sorry, it's not listed in these diagrams. So this is the very lower part of your belly. It's called the mons. Mons means mountain. And so it's kind of a mound of skin. And this is often where pubic hair starts to grow. And then there are also two sets of lips called labia, which I want to talk about. So first of all, so labia, I'm gonna be using this word a lot. So labia means lips in Latin. So everyone knows that they've got a pair of lips like on their face. So if you think about the way the lips on your face look, they're horizontal. Now turn it 90 degrees. So turn those horizontal lips vertically. And if you look at the vulva here, you can see that there's actually two sets of lips in your private area as well, and that's what we call them labia. So the first set is what we call the labia majora meaning big. The other set is the labia minora or small, so the small set of lips. So the labia majora is covered in skin that's really similar to the skin on like your arms and your legs, whereas the labia minora or the smaller one is covered in skin that's very similar to the skin on the inside of your mouth. And the reason why I want to spend a little bit of time talking about the differences between these two is because I get a lot of questions about the labia minora specifically. Just like how there's all the different types of sizes and shapes of breasts, there's also many different sizes and shapes of the labia minora. And so sometimes the labia minora can be longer than the labia majora, and you can see it. Sometimes they're shorter than the labia majora, and you can't see it. And so I get a lot of worried moms in my office who, maybe are used to seeing shorter labia minora and they see their daughter having longer ones and they're like, "Oh, what is this skin? I'm not used to it." And chances are it's normal. Just like how breasts can be asymmetric or where one side is bigger or is longer than the other. Same thing with the labia minora. It's really, really common to have like one side be shorter. There might be variation in color. It might be look a little darker on the end. But I often get girls aged 12, 13, 14 come to me with concerns about their labia minora because this tends to be the time when you first notice them. When you're a really little baby, they're really small. Like sometimes not even doctors can see that they're there. And once you go through puberty, they start to grow. And I think that they start to grow faster than the labia majora. And so there might be a time when you're like, hey, what is this? I'm starting to feel something different. And there might be a time when it's a little uncomfortable, but I just want you to know that one, that's normal, and this does get better over time. It does tend to be the most uncomfortable in the 1, 2, or 3 years after your very first period, but it will get better, and this is normal. It just takes a little bit of time for the labia majora to catch up or become a little thicker, and it just kind of makes sitting on those labia a little bit more comfortable the older you get. So most people actually don't know what the labia look like because you just don't see anybody else's. And that's okay. And this is the thing. I really love my job, but like it is a weird job. My job is to look at lots of different vulvas all day long and to know, hey, what's normal, what's not normal. And there are just so many different variations of normal out there. But if you ever have a question about like, hey, am I actually normal down there? One, you can always come talk to me. And two, there's this really great resource online. I definitely recommend looking at this with your mom, like with your mom's permission. It's called the Labia Library, and it just shows what all the different types of variants of normal, different kind of labia exist out there if you're concerned about, hey, am I normal or not? I think that this is a really helpful resource for people with questions. Another vaginal change that you may notice is what we call vaginal discharge. This is actually something it's hard for me to explain. But it's this white or yellow, so you might notice like a white or yellow stain in your underwear. It's kind of like snot. It's like a little bit different, like kind of mucusy, and it's produced by the vagina, and it's actually normal. So discharge is mucus or snot plus fluid. Once again, hormones love to make fluid in your vagina that then just kind of leaks out onto your underwear. And the thickness and color change throughout your menstrual cycle or change depending on the time of the month that you're in. And so you may notice discharge in your underwear that is light and yellow, and that is normal. In fact, that's a sign of puberty and is often a sign that your period is about 6 months away. Sometimes the discharge can be white and thick. Usually, this happens right before your period or right at the end of your period. Sometimes the discharge looks like egg whites where it's clear and stretchy. This happens around the time of ovulation or when your body is releasing an egg. It's sometimes clear and watery, which can happen during exercise because there's a lot of sweat there. And it's actually normal to have a little bit of a smell, but it shouldn't be a very strong smell, and it really shouldn't smell like fish. If there's a fishy smell, if it goes away after a day or two, hey, that's normal. But if you're like, hey, this fishy smell isn't going away, then come talk to me. That's really common. That happens to everybody at some point in their life. It just means that there's an overgrowth of good, healthy bacteria in the vagina. There's just a little too much of them, and we might need to give you an antibiotic to help lower how much bacteria is there. Okay, so those were the vaginal changes, but let's talk for a bit about periods. So first of all, this is here meet the players. So first of all, this is the uterus. So this is where babies grow and develop. Most of it is a big muscle, but this is also where your periods originate. There are two tubes that are attached to the uterus, Their job is to vacuum up the egg that is released from the ovary. The ovaries look like two little almonds, one on each side. Their job is to store and release eggs once a month during the menstrual cycle. The cervix looks like a donut. It feels like the tip of your nose, and it is the entrance to the uterus, and it is at the very top of the vagina. So a period is when, throughout the month, the uterus, once you start puberty, builds up a lining within it. We call this the endometrium because it is like, hey, in case I get pregnant, I want an egg to be able to land in a nice soft nest. But turns out you're not going to get pregnant for a while and you don't get pregnant every month. And so when your body realizes that you're not pregnant, you're like, hey, I don't need this nice soft lining. And it sheds that lining by bleeding, and the lining goes out the uterus and out the vagina and onto your underwear. And that's what we call a period. And so, how will you know that your period is coming? So, rule of thumb, if you've been wearing bras or you've noticed that your breasts have been around for about 2 years, most people's periods start about 2 years, sometimes 2.5 to 3 years after they first started noticing breast buds. You can also get this special type of discharge. The medical term for it is leukorrhea. Don't worry about that. It's like a big, big, scary name, but it just means vaginal discharge that starts about 6 months before your period comes. So if you see some sticky stuff on your underwear, you should be like, "Hey, I should get ready for this period to come." So how long do periods last? So it's different depending on who you are. Some people bleed for just 3 days, and other people bleed for up to 7 days. Usually during your period, it starts out kind of light, maybe medium, and then you have 1 or 2 or 3 days that are a little bit heavier. And then it ends with maybe 1, 2, or 3 days of really, really light bleeding. We call this spotting, where you just see like maybe a couple drops of blood on your underwear. Periods come. So, how often do periods come? So, generally speaking, they come once a month, but it's not actually that simple. In the very first year of your period, anything can happen. It can take some time for your brain and ovary to learn how to talk to each other and have a normal monthly period. So, you may have one period in your first year, or two, or 12. It could be perfect right from the get-go, or it could be really unpredictable. But basically, anything can happen in the first year. So, moms, just some things to look out for. So, if you're ever bleeding for more than 7 days, if you skip more than 6 months between periods, or they're coming more frequently than every 3 weeks or 21 days, I definitely want to know about that. But other than that, that's anything can happen in the first year. Year 2 or 3, things can still be a little irregular. So we say a normal period comes every 21 to 45 days, or basically every 3 to 6 weeks. However, once you've been having your period for about 3 years, we really want your periods to come either every 21 days or every 3 weeks, to every 35 days or 5 weeks or so. So generally periods come once a month, but because not everyone's cycles match perfectly with the months, because not everyone has 28 to 30-day periods, sometimes it's normal to get a period at the beginning of the month and the end of the month. Um, and you may not always get it on like the same day of the month. Everyone's got a unique cycle, and it's going to be important for you to track it. And we'll talk about that in just a second. I get asked, like, how much are you going to bleed? It's actually really hard to describe how much you're going to bleed, but it's really a total of 2 to 3 tablespoons of blood on average. Some of the blood can be bright red, sometimes it's dark brown. We don't get too worked up about it depending on the color. You might even see some small clumps of blood. These are normal. These are called blood clots. As long as they're small, that's something that can happen. Periods can unfortunately hurt a little bit. We call these period cramps. Usually the cramps are mild and just last for 1 to 2 days. They usually feel crampy, kind of like what the name suggests, and it's usually in the lower part of your belly. But sometimes you can feel them in your back, your thighs, or even your labia. Sometimes they feel sharp, or even like you have to poop. The best things that you can do are one, a heating pad or sitting in a warm bath or shower exercise is also a really good way of treating your cramps, or a class of medicine called NSAIDs, which is basically ibuprofen or naproxen. Don't be afraid to take this during their periods, during your periods. They really do help. Um, no one will know that you're on your period unless you tell them. Um, sometimes I get asked if period blood smells a little. The best way to manage any odors associated with your period are to change your pad and your tampon often and to shower or bathe daily, especially on your period. I really want to emphasize, please don't ever use a pad that has a scent in it. This can cause some real skin irritation. Um, what do you do if you leak under your clothes? Well, first of all, you are in good company. This happens to everybody at some point. And it's actually really common to leak under your bed or onto your clothes once in a while, especially while you're first learning how to manage your period. So a tip or trick that all of us girls have used is by tying like a jacket around your waist so you can't see the blood. You can also talk to a trusted friend or adult to help you track down a new pair of pants. A lot of times people don't like wearing white or khaki during their period and they opt for like the blue or the black so that if they do leak, you don't see it as much. There's something called PMS that you might have heard about called premenstrual syndrome. So once again, hormones are responsible for these periods. And hormones are amazing. Like what is happening to your body? Oh, it's so amazing, so interesting. It's like magic. But some of these hormones have some side effects. Right before your period, you might notice that your breasts are a little sore. You might crave certain foods. You might have some mood swings, or you might even have some breakouts with your acne. It's very important to track your period. So we want to know how many days are you bleeding for total and how often is it happening? You can use your phone, you can use a calendar, you can even use a period tracking app. But it is really important to know how many days you're bleeding for and how often, because it's important for your doctor to know and your pediatrician. We consider the length of your cycle, count from day one of your bleeding to day one of your next period. Don't count from the end of bleeding. It's day one to day one. So I recommend, if you haven't already, making a period kit to store in your backpack with your mom. This kit should have pads, an extra pair of underwear, or even unflushable wipes for those messy days. I also recommend learning how to open a pad and put it on your underwear and practice the whole thing so that you are completely prepared for that first period. But let's say that you get your first period while you're at school or when you're away from home and you don't have a pad. So that is where toilet paper comes in. We have all done this. If you find that you are on the toilet and you're like, oh, my period started, what you do is you take a wad of toilet paper, you fold it up, you put it on your underwear to use as a temporary pad for you to track down a trusted adult or a friend and ask for a pad. Somebody is always has something. And do you know what the really cool thing is about puberty and periods is that you are entering this community of women who we all deal with periods. I mean, almost everybody. And we've all been there. We've all been without a pad. We've all leaked onto our clothes. And if you ask for help, even if you don't know the person, we're like, yes, absolutely, I can help you. So this really is a wonderful community, and it's kind of a cool thing. All right, I'm running out of time here, so let's talk quickly about pads and tampons. So there's different ways to manage your period blood. So pads are sticky things that stick to your underwear and they absorb any blood that comes out during your period. Tampons, these are a little advanced. So these are like cylindrical things of cotton that go inside of you. So not in your underwear, they go inside of you to collect the blood. And these are really nice for sports and swimming. And this really cool thing that they've invented in recent years is called period underwear. So instead of having to worry about the pads, you can just put on a pair of super absorbent underwear and go about your day. So these are pretty cool, especially when you're first getting started with your period. So there are a lot of different periods out there. There's really thin ones. We call them panty liners. Those are for your light days. And you don't feel them very often. You can even wear them when you're not on your period if you're expecting your period to come. Regular pads are for your medium and heavy days. And then they also have these thicker ones that are really good for sleeping in, so you don't have to wake up to change your pad. They also had pads with wings or sticky things that go under your underwear that help keep your pad in place. So, how to use a pad? First off, you unpeel it from the wrapper, you unpeel the sticky part, and you lay it down on your underwear. And then when you pull your underwear up, you really want to make sure that the fit is okay and adjust it. If not, it's going to drive you crazy if it's not sitting right. Once you're done with your pad, so about 2 to 4 hours later, you're going to sit on the toilet, peel it off your underwear, roll it up, wrap it in paper towels, and please do not flush it down the toilet. You're going to put it in the trash can instead. If you flush it down the toilet, it's going to cause a massive clog because all of that pad is designed to absorb water. So please don't flush it down the toilet. All right. Tampons are a personal choice. There is no right age when you should or should not be wearing a tampon. You can start right away or never wear them, and that's okay. But they are really convenient for swimming and sports because it's really hard to go swimming in a pad. And there's a string, so the tampon sits within your body, but there's a string that hangs out that allows you to pull it out. But it's really important not to leave your tampon in for longer than 8 hours at a time. So in general, you should be changing your pad every 2 to 4 hours just to help manage any smells that come up or make sure that the pad doesn't fill up with too much blood and then you leak onto your clothes. It's also important to change your pad right before bed and right after you wake up. Period underwear. This is the last thing I'm going to talk about today. Right. So the way you wear them, so you put them on just like regular underwear. And then when you're done, you rinse them in cold water to remove as much of the blood as possible. And then you just stick them in your washing machine. Don't put them in the dryer though, and you can wear them again. So they're pretty convenient. And that wraps up my talk. You are going to do great. Puberty is exciting. There's all the feels, but we are here to help you. So please reach out if you have any questions about your body. And I'm happy to answer any questions for anyone who may be listening today.
That was incredible, Dr. Woodfield. So, so fantastic. So, yeah, if anybody has any questions, I apologize. I know that some of you didn't have the link ahead of time. I sent it to you right as she started, so you didn't miss anything. But if you do have any questions, so please submit them in the Q&A right now. I do have one. Will my period and cycle be similar to my mom's when she was younger?
Oh, that is such a good question. Uh, Sometimes yes, and sometimes no. Sometimes your cycle is more similar to like the grandma on your dad's side, and sometimes it's more similar to your mom's, or sometimes it's uniquely yours. So sometimes you can use it you can use your mom's cycle to predict what yours is going to be like, but sometimes not.
Great, thanks. The other, you had mentioned deodorants. I hear a lot about a more natural deodorant. Do you recommend natural deodorants? Are they
Ooh,
better?
yeah, that's actually a good question. So there, a lot of deodorants have aluminum in them, which there's the jury's still out about if that's how healthy that is or not. So some people do choose to use more natural deodorants. At the end of the day, you don't even have to use deodorant. You can just use like soap because once again, the smell is like the bacteria and the sweat, and if you can wash them away, it tends to work well. I don't know if I could like say, oh, you should always use natural deodorant, but I don't think I don't think you're going to go wrong if you choose a natural one over one that has like more aluminum in it or more synthetic things in it. So it's always a good choice.
Great. We did have one question. How long do the cramps stay in one day?
Oh, so good. It really varies from person to person. So for some people, it's just a couple of hours, like maybe right before the bleeding starts or right after the bleeding starts. For other people, it can last like be kind of off and on for a full 1 to 2 days. Sometimes if your mom or your sister has really bad cramps, it actually lasts longer than that. There's a chance that that could happen to you. Um, One of the things that's really important to me is I really believe that periods, especially period cramps or even heavy periods, should never keep someone out of school. It should never keep someone out of sports or doing the things that they love. And so if you're like, hey, I don't know if these cramps are normal or not, or even if you think they're normal, but they're keeping you from doing what you love, please come talk to me or your pediatrician so that we can find ways to help you.